Hello. Okay, we're live here to check that our channel is working or not. This is simply a test, and we will finalize the quality testing. This is just a test. So this is our public first trial. Let us see if the audience is accepting. Yes, I can see one. Live chat is disabled. Okay, the content is made for kids, so I think Google is supporting it, and I really appreciate what they have done. uh, Good effort. So as long as people are watching this channel, I am going to share my ideas on how people think on different issues related to coronavirus. If you cannot see anything in the image or in the stream broadcast, please do not be alarmed. This is an audio podcast, considered as an audio podcast, not as a video stream. This this session is for uh, sharing information and updates on the coronavirus. And as I share with you uh, different updates, let me just Google them. Yeah, I'm not sure to use Google because we are streaming on YouTube. So using Google is just a decent way to gather information as soon as possible. Let me check. Okay, the latest update from WHO, which is the World Health Organization, since April 1, 2020, the situation report number 72 describes as follows. I'm reading it, let it open up first. Okay, three new countries, territories, and areas are reported cases of COVID 19 in the past 24 hours. They are Botswana, Burundi, and Sierra Leone, so we should take precautions to save ourselves, first of all, and keep update with the latest update on COVID-19. Uh, the next highlight would be that WHO has released a scientific brief on the off-label use of medicines of COVID-19. That means the drugs which are not labeled specifically for the use or for treatment with COVID-19 can be used, but not in circulation for prescription use. Such drugs can also be used for treatment of COVID 19. A number of medicines have been suggested as potential investigational therapies, which are regulated by WHO. Most of them, I'm not sure about it, many of which are now being or will soon be studied in clinical trials. So there will be our, like say, a random rapid clinical trial in a short session, probably conducted with statistical whereabouts and processes to gain more information with use for medical treatment and therapies. So many of which are not being investigated uh, in the experimental drugs, will be studied in clinical trials. Okay, uh, give me a moment, please. Okay, okay. Uh, there's a solidarity trial co-sponsored by WHO and participating countries. For more information, can be found. And that's not important. There's a solidarity trial which is being conducted to aid with developing COVID-19 treatment. And the next highlight will be WHO recognizes the importance of addressing the needs of refugees and migrants who, when preparing for responding to COVID-19 pandemic. That means a lot of people have been migrating to different countries for work or for different aspects of life, and some of them might be in refugee status, trying to seek asylum in different countries after being persecuted for different reasons. So, such patients who have a refugee status are giving special priority, and they're being like being helped by WHO. This is more of a, what you can say, a simple confirmation, but I doubt about it. There are many people who have refugee status and having a bad condition. So this is a point debate. Now, second point is at the press briefing yesterday, PAHO Director Dr. Carissa Etine, I think I have pronounced her name correct. It's Carissa Etine, stressed that countries of the Americas must act now to slow the spread of COVID 19. WHO encourages countries to prepare hospitals and health facilities, protect their health personnel, and decide what social distancing measures need to be implemented for how long. That's important. Yeah, social distancing is the most appropriate way to control the spread of the virus. Social distancing has to be practiced. Uh, Public health and social measures to slow and or stop the spread of COVID-19 must be implemented with the full engagement of all members of society. WHO has described four levels of COVID-19 transmission with varying public health and social measures. Depending on the on the local evolution of the COVID-19 pandemic, more details you can see in the subject. Okay, there's a map over here just showing that the number of cases which are ranging from 1 to 50,000. Okay, they have been indicated in a color map, which is indicated globally. So, number of cases which are more than 50,000 are highlighted in countries like America, Alaska, North America, to be precise, and parts of England, Europe, and Italy and France, and more of some areas in Iran and the Mediterranean. The case range from 1,000 to 10,000 have been reported in places like Australia, Russia, Japan, and India, and parts of Brazil and South America, and Canada, and some parts of Mexico. So the transmission has been. Okay, I'm sorry to hold this live streaming for some time. There are some information which have to be tabulated before uh, speaking on debate for them. So we will conclude this into a different live stream, the next streaming. Until then, stay tuned and goodbye. Take care.